Hi friends, I am Dr. Amit. I am a plastic surgeon and we are going to be talking about breast augmentation or breast implant surgery. Now, breast implant surgery is one of the commonest of cosmetic surgery procedures worldwide. And I would like to reiterate the fact that, see, these are breast implants. The modern generation breast implants are absolutely safe. In fact, if I take a scissor and I actually cut this implant maintains its shape. It does not leak. Now, that is one of the most important questions patients ask. What would happen if it bursts inside the breast? Actually, nothing. First of all, these shells are so good, I can actually press this as much as I want. I can do anything with the implant. I can throw it on the ground. Nothing will happen to the implant. They do not leak. They do not burst. These are excellent quality products. However, a note of caution, the patient must insist on the best US FDA approved breast implant. There are some cheaper ones which come in from Korea and Japan. Korea and China, and they are definitely not to be used. Now, some of these, if you press, they actually start leaking. Now, one can imagine what will happen if they are put inside the breast. They are very cheap and unfortunately, they are pretty bad in their nature. Unfortunately, some doctors do perform those implants to save costs and cater to patients who unfortunately do not have budgets for greater quality breast implants. My request is, if one wants to do a breast implant, please only go for very high quality ones. A second myth which a lot of patients have is, does it cause cancer or any other autoimmune disorder? Now, it has been proven absolutely that this does not lead on to cancer, and in fact, if a person has family history of cancer, surveillance with the breast implants is not a problem. There are some websites which mention that one cannot see any future development of breast cancer with an implant. Do not worry, it is very easy to do a surveillance of the breast. A third point which a lot of patients ask, especially the younger ones, can they breastfeed after a breast implant? Of course they can. Now, a breast implant is only put behind the gland or behind the muscle. It has nothing to do with the milk production which actually occurs within the breast gland itself. So, there is absolutely no issue in going ahead with pregnancy and breastfeeding after a breast implant. And of course, always every patient will ask, safety. It is absolutely safe. Trust us on that. It is the commonest of all procedures worldwide, and this is one of the commonest and the safest procedure. Now, we normally perform a breast implant surgery in about half an hour to 45 minutes, and a patient is again discharged within 2 to 3 hours of the procedure. So, there is hardly any recovery. Within 48 hours, the person can get back to work, and there is absolutely no procedure related issues with breast implant.